Thank you guys all for coming. First key takeaway, we need to shorten our bios. That is bio. I'm glad you guys are here. The topic of this presentation is why is my teen so mean? So you're either here for some reassurance, you're here to try to figure out from a sanity perspective, how do I stay on the course? Or you just want to be away from your teen who's not asking you for a ride or some money. So either way, you've come to the right place. I appreciate you guys coming here. The fact that you're here at an event like this today and in a classroom like this today shows that you care. And parenting is hard. I have 2 kids myself, and I gotta say it is the most difficult yet most rewarding thing I've ever been through in my life. And that roller coaster can happen within a 5-minute component. Right? You're like, oh my God, this is wonderful. I can't believe it. Usually it's when they're sleeping. Oh my God. And then you have these moments of like, I'm gonna pull my hair out. Was I ever this bad? Like, there was a time where I called my mom and apologized to her randomly in the middle of the day and was like, I am sorry for who I was. I now realize how difficult it was being a parent of said child. And, you know, of course, gracefully, she was like, oh, it really wasn't that bad. And then she laughed hysterically. Because the reality was, it is. Parenting a teen is probably one of the most difficult components that anybody can go through. This morning's presentation, where they had talked about the shared trauma of just being a parent. Right? I thought that was very evident, and really the resilience components, I really liked the presentation, but that piece I really held on to because it puts us at risk of just being a parent. And that in itself is very interesting to see how difficult it is. And the reality is there is no real playbook. Like, no one knows what they're doing. And it's probably the most important job you have in your life, and there's no job description. And you have like the worst boss who's constantly in mood swings and never gives you any positive feedback, and all you're trying to do is make them happy and make them into a happy person. And so the fact that you guys are here today, like, pat yourselves on the back, because that's more than what 95% of people tend not to be able to do. And so you've shown up, you care, and I appreciate it. Today's presentation will kind of talk about what's normal, because realistically, there is going to be some normal differentiation in the way that your teens act, the same way that there was that same type of behavior that you had as a teen. And I think oftentimes we kind of look in the mirror in these moments and be like, well, is this normal? Has this gotten to a point of, like, outside of the normalcy of what I should expect? And I think us as parents, it's very difficult to remember what it felt like to be that age again. And that empathy almost gets lost. And I feel like that happens at every stage of kind of life, is you forget how it was when you were in that mentality at that age. And even though cultures are completely different and society is completely different and social media really wasn't as hard of a component as it is today, the basic premise of how the adolescent mind works is kind of lost on the adult. And the adolescent doesn't really realize that until they become an adult themselves, and then they go, oh, now it makes sense. Hence the example of me calling my mother to apologize. So I'm glad you guys are here today. I mean, both of these wonderful psychiatric nurse practitioners are going to walk through some of the experiences that they have had and experienced not only through their practice but in their lives. And thankfully, they're here to kind of tell you about it, because me, myself, as an expert, would not be giving you great advice. So I'm happy to introduce both Jessica Casey and Jennifer Gray Schmidt to help do this presentation.
Thank you. Okay, so why is my teen so mean? My name is Jennifer, this is Jessica. We're psychiatric nurse practitioners. We are nurses by background, went to graduate school to get our nurse practitioner, and we do medication management and psychotherapy at a practice called Fulfill Health. So what are we going to cover? Jessica's going to explain to us what normal teen behavior is and what you can expect from your teen at the age that they are at. Whereas I'm going to be speaking about dysregulated behavior. And you're probably wondering, what's dysregulated? That's when someone, whether it's a teen or not, can't manage their emotions that's socially appropriate. So I'll go through kind of what the symptoms of dysregulated behavior are and what to look for. I'm also going to talk about potential causes of it. We're going to talk through interventions, your role as a parent, the role of what therapy has with dysregulation, and then when it's time to seek medication management. We also provided resources at the end. Okay, so before we get into like what's not normal, it's helpful to know what is normal. Take it all with a grain of salt because normal is a broad term. I don't even know it's normal anymore. And there are a lot of different theories out there, psychologists, you know, you've read about this and that, and this could explain that. And so it's a lot of information to take in. So Erik Erikson was actually a psychologist, and he kind of developed these, stages of conflict throughout everybody's age. So you can actually look it up and see where you fall into it as an adult. I'm not having fun myself right now in my stage. And this key conflict needs to be resolved to kind of go on to the next conflict. So if we're talking about the ages of 12 to 18, that's kind of the identity versus role confusion. This is where they're getting a sense of self, like sense of their self. Like who are they? Who do they want to be? Those morals, those values, how do they want to dress? It's not a phase anymore for me, sort of thing. And dyeing their hair, all that good stuff comes in that, so that when they get to 18, who are they going to be? And then teens, there's kind of this like theory around it that like, oh, my teen's lazy. Oh, they're laying in bed. They're not doing their homework. They don't have the willpower. They don't have the motivation. But actually, teens want to succeed. So actually, they will succeed. They can do well if they can. So like, if there's something that's preventing it, maybe it's like struggles at home, maybe it's like anxiety, depression, maybe it's like physical limitations, right? Inherently, everybody wants to do well. They want people to tell them they're doing well. They want to succeed. So kind of frame it that way, that like, what is preventing them from, getting up and doing their homework or self-care or something like that, right? It's just not an inherent lack of motivation. So normal. And I'm going to go in a little bit detail because some of this is a little challenging. Mood swings and independence seeking. I'm sure we've all seen the mood swings where one day they're like, hey mom, I want to hang out with you. And the next day they're like, get away from me. It's so much fun. So that's actually normal, unfortunately. Then being influenced by their peers. I have a 12-year-old right now, and I'm like, well, if your friends did that, would you do it too? And immediately he's like, yes. And I'm like, hello, no. What? And he's like, I don't know. And I'm like, oh my gosh, there's no critical thinking. So peer influence is a thing as much as we set values with them. They're going to do increased risk taking. Again, take this with a grain of salt because this is like, well, the rules say at school I can't dye my hair, but I'm going to dye my hair anyway, right? It's not like a rule that's going to get them in grave trouble or anything like that. So that's kind of that increased risk taking. And then, of course, our favorite, rebellion and defiance. So much fun. It's normal to an extent. They're trying to question authorities a little bit. They might say, well, why is that the rule? Like, I don't like that rule, and kind of push back with you or teachers sometimes. We all love those phone calls coming home. So those are kind of quote-unquote normal. Now, of course, normal but challenging. So this kind of takes some of those, it goes a little bit deeper. These are still quote-unquote normal, but they're really difficult because they trigger us, of course. So lack of communication is a big one. They seem secretive. They seem like they can't talk or like express themselves. I have a 16-year-old and I'm like, well, tell me about this. And he's like, I don't know. And I'm like, do you know the English language? Because like I can express myself and it's like, I don't understand. They might not want to tell you everything. So like sometimes his friend group changes and I don't know and I'm trying to find out. And then he's like, we're just going back and forth. And so that's actually kind of normal. Argumentative, so like I mentioned before, kind of challenging the rules. Now I have to explain, why rules are the way they are, and he's challenging them and doesn't like them because that's not what he thinks is appropriate. So that's also fun for me. Moodiness, so hormonal and social factors, like I mentioned, we can go back and forth. Sometimes it can be pretty extreme or seem very intense and extreme. And then our good old favorite, sleep deprivation. I'm not sure how they run off of like 3 hours of sleep, but somehow they're doing it. That's kind of part of like finding that sense of self, like learning how much sleep they need, they don't need. Of course, they're trying to stay up playing video games and texting their friends all night. So it's a little bit challenging. So then we talk about dysregulated behavior in teens, and when is it not normal? So what are signs that are going beyond the expected behaviors that Jess was talking about? We mentioned mood swings are normal, but when they become extreme, they're not so normal. So you want to look for like aggressive or violent behavior if you feel like your teen's acting unsafe at home. you say no to something that your teen then runs upstairs and starts like pulling paper or wallpaper off, or destroying the room, throwing things, coming at you or coming at another family member. When they become violent or aggressive, that's not normal. Having severe anxiety or depression, a little sprinkle of anxiety and depression is considered normal in anybody, but when it becomes severe, you want to look for certain signs in your children, such as self-isolation or withdrawal are two things where they're just like going right up to their room and they're sticking by themselves. Or they're isolating and they're not really socializing with their friends anymore. They're not sleeping or they're sleeping a lot. They're not eating or they're eating a lot. So kind of looking at those extremes and changing in their behavior. You're looking at like a decline in performance in school. Like they can't concentrate, they can't focus, they're not doing well like they were. There's like a obvious change in how they were acting before and now how they're acting. Other signs are like they're very fearful or they're very panicky and they're very nervous all the time. And that's not what they were like before. They have low energy or they feel very fatigued. Those are signs and symptoms of depression and anxiety as well. Stomach aches are common in kids. If they keep complaining about stomach aches or they keep complaining about pain, sometimes that's emotional pain, so they can't really put their finger on where their pain is, but it's coming more from their mind and from their emotions. That's difficult for them to manage. And unfortunately, I don't want to say common, but sometimes you'll see self-harm in kids, and teens especially, which is a coping mechanism to help with emotional pain or emotional distress. Just a little insight into self-harm. It's usually done by cutting, burning, pulling your hair, headbanging. Those are some self-harm behaviors. Places that you'll see self-harm typically would be like around your wrists or your arms, thighs, stomach, places that you can hide with clothing. So if you notice your kid's walking outside with long sleeves and it's like 75, 80 degrees, you're like, well, that's maybe red flaggy. Same with long pants on a summer day. They're just maybe trying to hide the self-harm. Suicidal thoughts are also a sign of severe depression, and that is something you can always ask your teen about. I know people fear that if I bring it up, I'm going to encourage them or I'm going to influence them to want to hurt themselves or want to kill themselves, but that's proven statistically to not be true. So if you want to talk to your child about suicidal thoughts, that's something that you can do. Substance abuse, not substance use. Substance use is common in children, or teens, I should say. They experiment. They go out, they try things, they do things, they like it, they don't like it. It's social, it's entertaining for a second, and then they may stop or they may do it more like on an inconsistent basis. But we're looking at depending on substances to cope, which would be like drinking to be numb, or drinking to forget, or smoking marijuana because I'm so anxious and I'm so angry. So it's more of a reliancy on substances or an overuse of substances in order to regulate your emotions when you feel like they're all over the place. So as a parent, when can you seek help? Typically, it's if the behaviors last a few weeks, like a day or two or a couple days of dysregulation, normal, fine, it may wear off. But if you're seeing that your teen's escalating and it's getting to a point where they're unsafe in the house or they're unsafe to themselves, that's when you could seek help. Same with if it's interfering with your daily life, where they're not going to school anymore or they're not showing up for whatever their responsibilities are, and it's interfering with the families also. So what are causes? Bullying, trauma, neglect. Bullying is whether they're being bullied or they're becoming a bully, are two reasons why someone could be dysregulated. We talked about aggression and violence, and that could show up as a way of bullying someone. It can also show up as a way of coping with being bullied. Trauma, you see there's a capital T on the trauma on the slide. However, little t traumas are also just important to look out for. Big trauma is like an event that happened that your teen was exposed to that they're trying to deal with the aftermath of, versus little traumas are repeated exposures of uncomfortable events, whether it's like a sexual event, a physical event, an emotional event, a neglectful event, and constant exposure to that or repeated exposure to it sometimes creates this fight or flight response or this emotional dysregulation where they don't really know how to cope with how they're responding to those events. Feeling neglected, whether it's by family or friends, being neglected looks different for everybody. Loneliness could be someone who has tons of friends just as much as it could be somebody who doesn't have any friends. So looking into like if they feel connected to people at school or connected to people at home. Slower emotional development, this is like if your teen's just a little immature. Like if they haven't yet developed coping skills, or they're like, 15, but they're acting like a 10-year-old. So it's like just taking them a little longer to hit that developmental stage that Jess mentioned, where they're in that role of conflict resolution. So they may just be responding more like with temper tantrums, and that could be why they're having more emotional dysregulation. They just haven't developed the skills yet. Situational stressors, something happens at school, something's happening at home, something happens with a friend. I know friends are prominent in the teens' lives. Unmet physiological needs. This could be as simple as like my kid's hungry, or my kid didn't sleep well, or they're not sleeping, or they're not eating enough, or they're they're dehydrated, right? These go down to the basics to make sure that they're fed well, they're sleeping well, they're drinking enough water, they feel loved, they feel like they have a home, they have shelter, comfortable clothing, all of that stuff.
So Jen talked about kind of like what could cause dysregulated behavior, but how do we like determine what is that cause for your teen in specifics? So the first one, and I cannot stress this enough, is just communicate. But you have to communicate very openly. We want to basically be inquisitive, be non-judgmental, because we want to build trust. In my house, I kind of like have an open door policy where like my kids can come to me and like ask me a question, and I answer it without like follow-up questions. Like one time my son's like, hey, I want to know about this drug. I'm not going to sit there and be like, well, why are you asking about that? Are you doing drugs? Is your friend doing drugs? Like, where have you heard that, right? I'm just like, oh, here's the drug, here's the consequences, and I move on. So making sure that every time you communicate, you're just being open and non-judgmental and being inquisitive. Sometimes I ask follow-up questions. I'm not going to assume what he's getting at, just to see what he really means. Again, back to he can't articulate himself correctly, and is having a hard time expressing themselves. So this can be hard, obviously, when they're being secretive, but consistency is key. So keeping the same patterns of being open, being non-judgmental, time and time again, is key. You will not see responses at first. It might take a while, but we got to create that consistency. Next, we want to observe. Obviously, we all look for patterns. So like Jen mentioned, like if you're seeing long sleeve go out, like that's a pattern. Or, hey, my kid used to be really social, and this like past couple months, like he doesn't ever want to go hang out with his friends, stuff like that. Like these are patterns that we're all looking for. Specifically when I see kids or teens, I'm like, how are you eating? And they're like, good. And mom's like, no, actually the past like week, they've only eaten like 50% of their meal. And yesterday they didn't finish their dinner. Like they're watching these patterns of what's happening, right? So those patterns can add up to a big picture. And then also we can consult professionals. So preface to that, we always want to set a positive tone about consulting professionals. A lot of times it's our knee-jerk reaction to be like, well, if you don't talk to me, I'm going to take you to a therapist. I'm going to make you talk to them. And like it sets this tone like that's a bad thing. So first and foremost, if you'd be like, part of that communication is like, hey, if you don't want to talk to me, let's bring you to somewhere where they will keep your data private. They won't tell me, and you have somebody to talk to. So setting the tone is key. And just kind of consulting them to see what's going on. It could be, obviously, like Jen mentioned, trauma. If you know something had happened, you obviously want to initiate that process to find out what's going on. But even if you're unsure, like if you're like, I'm just noticing something, nothing's really happened that I'm aware of, they're acting kind of weird, yada, 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 just start that process to talk with different professionals can put you in the right position. So this kind of leads into like, what is your role as a parent, right? No pressure, guys, don't worry. So first step is to just recognize your bias. It doesn't matter if you had your kids when you were young or when you were older or whatever the age gap is, there are different generations. Even for myself, I grew up where I didn't really have cell phones until I was older, and so with my kids being on their cell phone all the time, I'm like, settle down, guys. And it's my knee-jerk reaction to parent based on the way that I was parented. However, that can feel really restricting and not such a good thing. So recognize like where your biases is, where your values are, and kind of use that as a frame of reference to then parent them based on their surrounding contexts. So the one thing I always say is boundaries. We can't fault them if they didn't really know the rules. It sounds kind of dumb, but sometimes with my kids, I'm like, this is the rule, and I like write it out. Because they'll be like, well, you didn't say that exactly. And you didn't say that yesterday. And I'm like, but you would think it's implied that we don't do drugs. Let's just write it down, guys. So it's kind of hard to get them in trouble when you didn't make that clear, you didn't communicate. Another thing, we want to lead by example. This is much harder than it looks. My teen started driving and I made a rule no empty cups and food in your car. Meanwhile, my car is littered with Dunkin' Donuts right now, okay? I'm just gonna be honest. And so I need to lead by example. So now I'm cleaning my car because it kind of, even though it's well, I'm the parent, you're the child, and my rules, they don't understand that. That's not how their brain works. You need to show them that hey, what I hold you to, I'm gonna hold the standards to. Same thing with drugs. So as we know, marijuana is legal and some people like to take edibles before bed. That's, anybody's prerogative. However, you can't be yeah, you can't do marijuana, but then you go take an edible and they know where your edibles are and they see you doing it, right? It's again that double standard. So kind of setting the tone for what's acceptable by leading by example. Another thing is kind of this creating a routine and working with them on where they can make decisions. The more that you can let them make decisions, the more they're going to be regulated. A lot, when you look online at all of these things, a lot of it is a sense of they don't have control of their lives. Everybody tells them where to go, what to do, when to do it, stuff like that. And that in itself is agitating. I mean, when my husband tells me that I got to do something, I'm like, excuse me, who are you talking to? So kids inherently do the same thing. So setting, again, just like those rules, writing out where can they make decisions. Can they make decisions in their haircut and style? My son decided to dye his hair, bleach his hair and dye it blue. Would not recommend, but if that's what made him happy, fine. It's going to grow out. He's going to cut it. It's going to go back to normal. Who am I to judge? So hairstyles, maybe clothing that they wear with limitations, obviously. Or if they're getting an allowance, letting them budget. If they want to go blow it all on, Fortnite, then you don't have money until you get paid next time. That's on you. Kind of, setting those boundaries, letting them make those decisions. And then, again, looping back onto the open communication, that falls on parents, unfortunately. And so, like I mentioned before, being inquisitive and stuff like that, allowing them to state their case. So there are a lot of times that I have conversations with my son, and I'm like, you can't do this because X, Y, Z, whatever. And he used to shut down and get really frustrated and go slam his door. But then now we have it where he's like, well, you told me via text a week ago that I could. And I'm like, oh, sorry, I actually forgot about that. So allowing them to rebuttal or state their case, or sometimes he tells me an angle I didn't think about, and so without faulting them for talking back, we're kind of eliminating that tension. And then another big thing is be okay with tabling things for later. I'm a really impatient person, and I want to know now. And so oftentimes I found myself, constantly questioning to get an answer. But it's he has a test tomorrow and he wasn't feeling well today. And I'm pushing him to have a discussion when it's not the right time. And so being okay with hey, this is what I want to talk about. Let's talk about it later. Not only diffuses the tension, but allows them to think about how they want to articulate themselves instead of being put on the spot. So this is kind of just, again, take it with a grain of salt, all encompassing how it kind of is the parent's role to help with that dysregulation and kind of diffuse it day to day.
So the role of therapy then. We listed off some potential treatment options when it comes to therapy, and I'm just going to explain what the different ones listed are. Cognitive behavioral therapy, this is a very strong evidence-based therapy approach for adolescent anxiety, for any anxiety, depression, but in adolescents specifically. It's helping teach how to identify thoughts and feelings and modify the negative thoughts to become positive behaviors. So it's essentially connecting your thoughts with your emotions and your behaviors. So you start with challenging negative thinking patterns, understanding what the emotion connected to that is, and then how am I going to respond to it. It's very present focused, so it talks about the here and now and how to cope with what's going on in your daily life. So if it's somebody that's struggling with anxiety in their current situation, it's a good approach to take to be able to cope with that. And it's also just skill building, and most therapists are very well versed in CBT. DBT is designed an evidence-based approach to help with extreme emotions and to behaviors, from like de-escalate extreme emotions and then create positive behaviors in return. So you're still developing coping skills, but it has a different kind of approach where it uses these core components. So the 4 core components of it, the first one's mindfulness. So it's really just like sitting in this discomfort and understanding like what's happening in your body at present. And so your teens can practice like understanding like, okay, I'm angry right now, or I'm sad right now, or I'm mad right now, or whatever. I'm really excited right now, and just understanding that emotion and sitting with it before they impulsively act on it. So I'm really mad right now, I'm gonna go throw something, or I'm gonna go punch something. But when you instill this mindfulness, it's like, I'm so mad right now, what do I wanna do about it? Would punching something help? Probably not, it'll just hurt my hand. So I'm gonna sit with this and figure out what I wanna do about it. Will help them decrease the impulsiveness and hopefully like those extreme mood swings. Distress tolerance is teaching how to tolerate the distressful situation, right? So it's coping with crisis. And it's accepting like the reality of your situation, and it's using grounding mechanisms to kind of like alleviate that intense, severe feeling, and just kind of like breathing it out, getting your senses back on track, and self-soothing, and then using other things to kind of de-escalate the crisis so that you don't act out on it again with that impulsive behavior. Emotional regulation, that's similarly understanding and managing your emotions. It's supposed to help with decreasing your vulnerability and increasing your resilience. So things are intended to not bother you so much when they're like socially not supposed to be bothersome. Interpersonal effectiveness, this is helping teens with creating positive relationships and communication styles. So communicating how you're feeling instead of acting out is something that they learn in DBT. And it does create healthy boundaries because it also promotes like self-respect and speaking up for yourself. So kind of what Jess was saying, like having that like rebuttal or speaking up for yourself as a teen doesn't have to be viewed as a poor thing. It could be viewed as self-respect. So as a parent, you can encourage it, like give me your side, or let me hear what your thoughts are on that. Even though you may not agree with it, it's still nice to practice your teen having that opportunity to speak for themselves. Trauma-informed therapy, or family therapy. So this is recommended when you have a teen with emotional dysregulation. It just showing up as a unit helps promote a healthier like lifestyle at home, just because it creates this form of support, and it helps you understand what's going on, creating coping mechanisms together, coming up with a plan. Kind of how Jess was talking about the parent role, like those are all things that you can learn specifically for your teen and what your teen needs, and having like a mediator or someone to kind of help guide those conversations could be helpful. So it's really just to create this like strong unit again, so that there's no misunderstandings of what's going on between you and with your teen. Trauma-informed therapy, this is like kind of a modality that's integrated in a lot of places now. In the mental health field, the providers are trained to be trauma-informed, and really it's just meant to create this safe space, right? So supportive, trustworthy, patient, non-judgmental space where if there is a big T or a little T that your teen has gone through, that's being considered in conversation during the treatment, and it's being recognized and reassured. It's kind of this approach where it's like, instead of saying what's wrong with you, you're looking at what happened to you. And that kind of shapes like why your teen is acting a certain way, kind of with all the different causes of the dysregulation. So you're looking at the teen as more of like, what happened and how do we resolve this, versus what's wrong with you, what can I diagnose you with, and how can I fix you. The last 3 are more higher level of care approaches to treatment. So like I said, me and Jess are in the outpatient setting. We do private practice medication management. The highest level of care is considered inpatient hospitalization. This is when your teen goes to the hospital and gets admitted to a psychiatric unit. And on a psychiatric unit, it's focused on 24/7 care, monitoring your teens' behaviors, their emotions, their regulation, trying to program and help them create coping mechanisms through group therapies. Typically, it's a bunch of teens there together, so they're all going through group therapies and talking to the therapist. There's also, in certain facilities, private therapy to kind of go through why they're in the hospital to begin with. There's doctors and nurse practitioners that manage medications on a daily basis, go up and down on meds with the monitoring of nursing staff. So this lasts anywhere from a few days to a few weeks, depending on why your teen needs to go to the hospital. Common reasons to go to the hospital are those severe cases where they're just not safe for themselves or they're not safe for others. So if you feel like you don't know what else to do, you can always just call or take them to the local ER and have them get an evaluation. And if the crisis team in the ER thinks that they're a good candidate to go into the hospital, they'll admit them to the unit and start care then. After inpatient hospitalization, a common discharge plan would be to go to a partial hospitalization program. This is where the teen goes to like 5 days of therapy for 4 to 6 hours a day. So they come home at night, they eat dinner, and they sleep at home, but they still are transitioning out of this inpatient setting. So it's trying to continue to promote those coping mechanisms, that emotional regulation. It's trying to transition a little bit more smooth instead of being in a hospital setting for, 3 days to 3 weeks and then having to just go home again. If home was very triggering for the person that was admitted to the hospital to begin with, or if school was triggering, you don't want to just throw them back in, you want to transition it. So that's the goal, is to just prevent relapse of going back to the hospital with just stepping down to a lower level, but still an acute level of care. Intensive outpatient programs, so these are a step lower than partial hospitalization, but a step higher than our outpatient management. So if we are seeing a client and we feel like once a month visits or therapy once a week isn't really helping right now, and they're still in this severe kind of mental headspace, we would recommend an intensive outpatient program. It's 3 to 4 hours of therapy, 3 to 4 days a week. It can last anywhere from 2 weeks to 6 weeks, sometimes a few more months. It's a lot more intensive therapy. It's working a little bit more in the nitty-gritty of everything, and it's transitioning to someone becoming independent again. So you're either transitioning into independence or you can't handle the independence, so you're going up a level to kind of get a little helping hand in that and a little bit more support.
That was a lot of information. Are you ready for some more?
And I talk fast. So.
No, and by the way, we're very passionate about therapy and medication management, so that's where there's like a lot of meat surrounding it, but the whole premise is like knowledge is power. The more you know about these different programs or medications, the more you'll feel comfortable exploring those options. So that's why there's a lot of information there. So medication then obviously is very scary. The amount of new patients I get that have never been on medications and parents are terrified, understandable. And I always start sessions by it took me years to start my child on medications, and I know these meds inside and out. So I get it. And there's a lot of misconception that meds mess with your brain chemistry. True to an extent, but it's not as scary as you would think. And sometimes it can be the equivalent of if you take Tylenol or other medications, we're still working with the body's chemistry, right? So you don't have to remember all of this information. I just want to kind of overview the different types of medications and kind of how they work. So meds usually are done in conjunction with therapy. That's where we get the most benefit. And the point of meds is kind of to take down the dysregulation a little bit, to allow them to use their coping skills and work in therapy. Sometimes when there's such an intense emotion, it's hard to even work in therapy. So a lot of times meds are used in conjunction. There are some times where they're used solo, especially too if kids have completed therapy and they're doing well, they will continue to be on medications. That's okay too. So the first medications are kind of like the tried and true first standard, which are SSRIs. So they're called selective serotonin reuptake inhibitors. That's like Zoloft, Lexapro, Prozac. Everybody's pretty much heard about those. They're very safe. They're very well tolerated. They're very well studied in kids and adults. And so essentially what this does is, like the name says, it prevents serotonin from being reuptake. So when the signals in the cell sends out a signal, basically, and the serotonin, and it gets reabsorbed. And you can think of it kind of like a recycling center. It's putting out serotonin, it's taking it back in. It's putting it out, taking it back in. There are several factors that maybe that process is happening too quickly. Or maybe there's not enough serotonin to begin with, so of course when it's being reuptook into the synapse, it's not really doing its job. So what these meds do essentially is like shut the door to the recycling room so serotonin can hang out for a little bit longer and do its job. So it's not, necessarily it's taking the serotonin that's already there and allowing it to work more efficiently. Puberty and hormones too can have a really big impact on this. So like testosterone can have a suppressive effect on serotonin. So like naturally, of course, then you'll see more anxiety, depression. Estrogen too can actually make serotonin receptors more receptive and more sensitive, but estrogen levels are like fluctuating during puberty. So that's where we see mood swings and stuff like that. So sometimes it's not inherently like, doesn't have to be necessarily like trauma or something happened. A lot of times we notice our teens are being more anxious and depressed, and it could just be hormonal. A common question I get asked are like, do they have to be on these meds forever? I don't know. So it could be temporarily, and sometimes people, again, if they're not producing enough serotonin, they might need it forever, or maybe we just need to get past puberty. So again, that's something that you discuss with your prescriber, and you kind of do check-ins along the way to say like, hey, do we still need this? Do we want to try and be without it? So that's kind of those meds. Now, the next step in meds, sometimes it's used in conjunction with SSRIs, would be like mood stabilizers. So these ones, you want to think more dopamine instead of serotonin. They do work on some serotonin receptors, but think dopamine. And so when dopamine receptors are a little too sensitive, you can see like risky behavior, impulsivity, like extreme mood swings. If there's a drop in dopamine, you'll see like boredom, depression, frustration. And if we have too much dopamine, they're going to be irritable. They're going to be, high anxiety, stuff like that. Now, as you can see, there's literally two sides of the coin. Dopamine can either cause anxiety or not enough is causing depression. It's like, two things can happen, and we don't know which one is which, right? So the way that these meds work is think about like a swinging door. And they work by kind of stabilizing that swinging door. So if there's too much dopamine, they're going to slow down the door. If there's not enough dopamine, they're going to help speed up the door. So they kind of work smart and intuitively at the receptor level, that swinging door, to kind of help them get more or less of the dopamine that they're already producing. So then what we're looking for is kind of like a regulation in their behavior, less irritability, less mood swings, less depression, less anxiety kind of things. This usually is a step above SSRIs, depending on their response, because we don't know if serotonin or dopamine is responsible for their behavior. So fortunately, it comes with a trial and error process. But again, we're just kind of weeding out where is that dysregulation coming from when therapy is not enough. And then, of course, the last ones on here I put are stimulant medications. There are non-stimulant medications. But for ADHD, you think, these kind of work by increasing dopamine and norepinephrine. So if we go back to that, like the dopamine, the swinging door, we don't know like what's causing that swinging door. This can help regulate that. So they work by twofold. Not only do they shut the door, like the recycling room analogy, but they can also stimulate neurons to produce more dopamine and norepinephrine. So I tell people, think of like ADHD of like a radio station that has a really weak signal, and you're like hearing voices in and out talk, and it's really hard to focus and concentrate on what the radio station is playing. And so the way that these work is they kind of fine tune that radio station to where it's nice and clear. There's not a lot of static going on. It's like a signal booster essentially, so that they can feel calm and collected. Because if I had a radio station in my head that's like going beat 90 and I can't hear anything, I'm going to be irritable. I'm going to be frustrated, right? So you think about all those behaviors, and if we can just de-stimulate that we can kind of help them calm those regulation behaviors. Again, we don't know when you first start this process necessarily what's going on at a neuron level. I'd be a millionaire if I could look inside people's brains and be like, yes, dopamine, here you go. So that's part of the trial and error process, but that's kind of in a nutshell how they work. They work just by using the brain's natural serotonin, dopamine, norepinephrine, and kind of making it work more efficiently and how it should. I know there's a lot of information, but yeah, so always, and when you go to a prescriber, always ask follow-up questions. Again, knowledge is power. It can seem like a lot coming at you, especially like right now. So always ask if you have questions on that. Okay, so that was a lot of information, but there are a couple of resources. So if you look online, if you do a good old Google search, you're gonna get a bunch of books. Jen and I like to read a lot, so we kind of recommend a couple of books to get you started that we have in fact read. We're not just throwing recommendations out there. So The Explosive Child really can help with that like emotional regulation and understanding where that's coming from. It's a really good read. The Gift of Failure is another one, so this kind of goes into a little bit more of that regulation type stuff. The Parenting Project, I love this one just because it really, sometimes I'm up here going like, guys, communicate with your kids, right? And it's like, hard to think how that's gonna go. So that book kind of really details those conversations and building a relationship with your kid. It's a really easy read, which I like. And then of course, if you are looking to get more like hands-on help, speak with a professional, you can go to Referral GPS. They will list out, you can actually choose what you're looking for and it helps you find different providers. And then of course, Psychology Today is just like a wealth of information. 9 times out of 10, a therapist or prescriber, we're all passionate about what we do, we'll have an initial visit with you where it's just education. And you can use them as a source of knowledge when it's kind of hard to like weed out what you see on Google. All right.